talk about death at all. And that is one thing certain in our life. Whatever happens in our life, one thing is very sure, very certain, that death. Sometimes some of us are struck with terminal illnesses. They face unbearable suffering, physical, mental, or emotional. There is no way out except for death. Voluntary assisted dying offers an option of dignified way, peaceful way of ending this suffering. A person has a right to make their own decisions about their body and their death. And this option of voluntary assisted dying has been available in all other Australian states. ACT, now finally this option is available here. The law was passed last year. Now this option is now available in ACT. From 3rd of November, this option would be available in ACT government. ACT, sorry, or is to talk about that, we have Kate Reid from the ACT government, who is leading the task force for the implementation of a voluntary assisted dying. Kate, thank you very much for joining us today on our radio program. Welcome.
Thank you very much. It's a privilege to be here.
Kate, let's start right at the beginning. For people who may not know, what is voluntary assisted dying?
So voluntary assisted dying is an option of end-of-life health, and that will go alongside palliative care. So voluntary assisted dying, by the very essence of it, means that it's a voluntary decision. It's assisted in as much as the person would have a condition or conditions that are life-limiting, and that they will die from as a medical legal process in which a person will request a substance, if they are found eligible, that they can take to end their life.
Right, okay. That's a good point. Now you said about the eligible. That's the key word. Mm-hmm. What is the criteria for getting access to voluntary assisted dying?
So there's quite strict eligibility criteria for very good reasons.
Yes.
You have to be over 18, and within the ACT, you have to be an ACT resident or have for the last 12 months, or have a strong connection to the ACT, which would allow you to get a residency exemption through the Health and Community Services Directorate, which is where the Taskforce, the Voluntary Assisted Dying Taskforce comes from. And you have to have had or have a condition or conditions that are progressive, advanced, and that will end in that person's life, and that they have intolerable suffering that they're experiencing. Now, they also have to be, it has to be voluntary, they have to be free of any coercion, and that they have to have decision-making capacity in relation to the voluntary assisted dying process from the very beginning to the very end and all the bits in between.
Right, okay. So looks like a very strict criteria. But then, when it comes to medical conditions, you mentioned that. Which illnesses qualify for voluntary assisted dying? Are there any specific illnesses or?
They're not really specific illnesses. It's just those that are life-limiting or those that are incurable that will cause a person's death.
Yeah.
And so there are multiple conditions, both malignant or cancers or non-malignant, such as end-stage organ failures like respiratory diseases or neurodegenerative diseases. And what makes the ACT legislation quite progressive is we don't have those prognosis dates that go with it.
Yeah.
So, but what's really important about those conditions is they have to be advanced and progressive. And
right,
so
okay.
We're looking really at those last stages of life.
Yeah. And that has to be done by medical professionals, I'm assuming. What is the process?
So they're authorised practitioners. That can be a medical practitioner or a nurse practitioner in the ACT. And there's also registered nurses who may be involved in the administrating practitioner part of the process. And so there are 2 independent assessments done of the person for eligibility criteria, and that's a really important safeguard to ensure that there are these checks and balances as we go along the process.
Yeah.
And to become an authorised practitioner, you have to have quite extensive experience already in the professions, in that medical profession that you're in, or in that nurse practitioner profession. and then they have to go through mandatory training and an exam to get the authorization to become a practitioner.
All right, okay. Now, you are a nurse practitioner and you are other medical professionals. Now, doctors and nurses are trained to save lives. How do they come to terms with the idea of helping people in dying?
Yeah, so my background is as a palliative care nurse practitioner.
Yeah.
And I think what's really important in part, being a medical professional, being a nurse professional, is relieving suffering and ensuring that patients or people have their choices and autonomy in their healthcare options.
Yeah.
And so when we're looking at relieving suffering and what that might look like to that person, that individual, to their families and their community, that's where we can sort of be able to ensure that people have their values respected and what they want in their end-of-life journeys.
Now, you mentioned about values. As far as death is concerned, we have certain beliefs, values, and culture also shape our thinking when we think about end-of-life choices. So when it comes to acceptance by the community, are these communities ready to accept a voluntary assisted dying concept?
I think every person and every community has their own thoughts and feelings and personal experiences that come into this decision making. And the beauty of it being a voluntary process is it's not for everyone, but there is still always those palliative care options that can help relieve suffering at end of life. And there's also all the other parts of end-of-life care that still exist. Voluntary assisted dying is just another option for people to consider. And it really respects, there was a lot of community engagement prior to the bill being passed. Yeah. And as the implementation has been going on, we have been involving the community a lot in what's going to occur and hearing back from them and trying to make sure that our messaging is really targeted towards those areas that we need to really address. And so in doing that, we've been respecting those values and ensuring that we have those options. And so people could take them or leave them, but certainly it's really important that people make a knowledge-based decision.
So you have been engaging with the community and having sessions and all that. What has been the response so far?
It's been quite a positive response, and it's really positive, maybe not in as much as that they want to necessarily go down the voluntary assisted dying path. That's not necessarily the way, but that they know that there's options, that they know they're being included in the conversations and know that they can make knowledge-based decisions. And it's also opened up a real ability to talk about end-of-life care and talking about people's preferences, and so they can speak to their families. You know, as soon as you start focusing on some of these issues, people start talking about it in the community, in their homes, around the dinner table, and just demystifying as you said earlier, the one thing that we're all guaranteed of is that we're going to die.
That's right.
But we don't talk about it.
Yeah, that's right.
As much as we should.
Yeah. Okay. So we were talking about the medical professionals and doctors and nurses. So what about these doctors and nurses? Can all doctors and nurses help with the voluntary assisted dying request, or can they choose not to be involved?
There is certainly the ability to be a conscientious objector, but what is essential is that if someone was to bring it up with a doctor or a nurse practitioner about voluntary assisted dying, is if they don't want to be involved, that's okay, but they just need to ensure that they refer them on, that they don't hinder the process, they don't hinder access. Yeah. Because the main ethos of these types of health interventions is that they don't have any hindrance and that people have good access, and so that the professional doesn't have to be part of it. Yes, but they can't hinder, and they have obligations under the Act to ensure that they pass on the information. There will be the Voluntary Assisted Dying Care Navigator service, which will be outside. It runs from Canberra Health Services. that will be the real support service, that there will be a phone number there, and they can anyone can contact them to find out information.
Right, okay. And I think you mentioned about the word itself says this is a voluntary assisted dying, and of course the person who is suffering from there, the consent needs to be given by that person. But then there are conditions. A lot of people suffer from dementia or mental illnesses. They may not be able to make decisions themselves, but they are still going through this unbearable suffering. Can these be covered under this voluntary assisted dying or not?
What makes this really important for the voluntary assisted dying legislation is that the person retains decision-making capacity throughout the whole process. And so if we're getting to a stage of like a dementia or a cognitive impairment where a person's decision-making capacity is no longer feasible, then they wouldn't be able to pursue a voluntary assisted dying process. However, if someone had dementia or cognitive impairment that wasn't causing that decision-making issue, and they had other conditions or conditions that were leading up to their death, and they were experiencing intolerable suffering, then that would be part of that process, that the eligibility criteria assessment by those two authorised practitioners independently will make an assessment to ensure that they do meet all the criteria, no matter what their other comorbidities are, no matter what their other illnesses or conditions are.
All right, okay. So I think you mentioned about the process, but I think support makes a huge difference when you're going through that. This is such a difficult process, even though it looks like voluntary process. What kind of services are available to help someone considering voluntary assisted dying? I mean, we're not talking about we're talking about the person who's going through that process and also the people around them.
Yeah, we're certainly not alone in that. And I think that everyone is going through that process. It's really important to support their family, not only during the process, but also in a bereavement phase as well. So, of course, as I mentioned, the Voluntary Assisted Dying Care Navigator Service, that will be stood up from the 3rd of November. So that will provide a lot of support, including social work type support or psychosocial support, and we'll be able to refer people on, but also the coordinating practitioner, the authorised practitioner who's mainly involved in the voluntary assisted dying process, will be able to work with the families, work with the person to ensure they've got the best possible care. And also having palliative care involved in that person's care, so that the two voluntary assisted dying and palliative care are working together, will provide that real holistic approach to ensure that the family and the person are getting the best possible management in their end-of-life journey.
All right, okay. Of course, when we talk about the voluntary assisted dying, and you indicated a little bit about safeguards, what kind of safeguards are available? One, to make sure that it's not misused. Second is that it's carried out safely and responsibly.
Okay, so there's, like we were saying before, there's multiple points of assessment. There's multiple independent authorised practitioners involved in the assessment. And there's also the fact that the person has that decision-making capacity, and that they are being always throughout the process, them ensure that there's no coercion. And coercion is one of those really difficult and complex areas in healthcare, let alone in just the community. And so talking about ensuring that the practitioners feel confident that they're assessing whether there's coercion. And we are standing up a community of practice. It's an authorised practitioners community of practice, so that those authorised practitioners can come together as real peer support for each other to discuss cases and to be able to mentor each other through the processes as well. And additionally to that, there is the Oversight Board, which is just the Voluntary Assisted Dying Oversight Board, which will be looking at cases retrospectively and involved in the reporting as well. So there's lots of different areas, and that's probably me just mentioning a few, where we can build these safeguards. But there's also supported decision-making processes for those who have any issues with communication, or if they've got fluctuating cognition. Everything doesn't have to be done straight away. There can be pauses in the process, and then people can come back so that they get the best possible value at that time. So of the consultation.
Right. Okay. Can you just briefly go again through the process of voluntary assisted dying?
Yeah. So it's a 10-step process.
Yeah.
And so the first one is making the formal and unambiguous request, and then there's a formal assessment done by a coordinating practitioner.
Yes.
Then there's the consulting practitioner, the next independent one. Then there is a second request. This one will be written, and if the person's unable to write, then they can get an agent to do that for them, and it's witnessed.
Right. Okay.
Then there's the final request, which is another verbal request. Then there's a final assessment, and the final assessment is really to make sure there's no coercion, and to ensure that decision-making capacity is still there and the person really understands what's happening. And then a decision is made about how the person will be taking the medication or the substance, and whether that will be self-administered or practitioner-administered. And then that prescription is filled and it's dispensed. And that's another safeguard, because we've got our Voluntary Assisted Dying pharmacy service, also out of Canberra Health Services, who will be able to, if it's self-administrating, meet with the person and their contact person to talk about what's going to happen. And so there's another level of sort of a check and balance to make sure they understand, they can store the medication safely. And then the person will take the medication, or they'll be administered the medication, and then they will die.
All right. You mentioned that it could be self-administered also. So would there be some assistance or supervision by the medical professionals when it's being done?
There's a lot of education about how to mix the substance, or a lot of education about how to store it, and all those really safe, important things that we need to talk about, and that the dispensing will be occurring very close to the time the person's deciding. However, the person, that's their autonomy to decide when they're going to take it. And so no, there doesn't need to be a medical professional or a nurse practitioner involved in the self-administration, because the person is able to take it. Right. If they aren't able to do that, then that is when we'll be looking at an administrative practitioner. Right.
Okay. So, and this consent of having this voluntary assisted dying can be withdrawn by the person at any stage?
Yes, any stage at all. Yeah. There is absolutely no, once you're in the system or the process, you do not have to continue it up until the time of the administration or the taking of the medication.
Yeah. Kate, that's been very useful information, and I'm not sure we will find out how this process is going to work in next few months. And hopefully that option is now available in the ACT, where people can go and get that facility, or I don't know can we call it, facility or an option of a dignified and peaceful way of ending life in cases of unbearable suffering, as you mentioned about the criteria. Thank you very much for coming to our studio and sharing this useful and valuable information.
My pleasure indeed. Thank you very much for having me.
Thank you.